Alright, so this is the 15 of our Mozo anatomy question series. So let's get right into the question. A 35-year-old carpenter is brought to the emergency department after falling from a ladder and landing on his outstretched right hand. He complains of severe pain in both his elbow and his wrist. Physical examination reveals exclusive tenderness over the radial head and distal radioulnar joint. So there's a tenderness over the radial head and distal radioulnar joint. Radiograph confirmed a comminuted fracture of the radial head and a distal radioulnar joint dislocation. The orthopedic surgeon notes that the radius has migrated proximally relative to the ulna. Disruption of which of the following structures is primarily responsible for the longitudinal instability of the radius in the patient? So here we have four options. Well, what is the problem? We are looking at a dislocation of the ulna proximally. Okay, so let's look at the option annular ligament. This annular ligament is like a ligament that holds the radial notch and the radial head and the radial notch of the ulna. It tries to hold them in place, okay? But it does not really it does not stop the radius from dislocating, even though it's a ligament. So that can be the answer. Oblique cord is just proximal to the interosseous membrane, but it's just vestigial. It's vestigial in the human body. Does not really have a function. The palmar radiocarpal ligament is a wrist. It's something in the wrist. The ligament in the wrist that holds the radius and the carpal bones. Right. It tries to hold them in place to stabilize the wrist. Ulnar collateral ligament is found at the medial epicondyle, right, and the function does not stabilize the wrist. So the answer here is the interosseous membrane, which is like a fibrous cartilage, a fibrous kind of cartilage, right, that spans over the radial head. It spans over two bones that are lying side by side to each other. Actually, that's the radius and the ulna, the tibia and the fibula. But in this case, we're looking at the radius and the ulna. So it's kind of span over or covers those two bones, and one of the function it helps to transmit force. For example, when you fall flat on your arm, it transmits force from the wrist to the radius, from the radius to the ulna, then from ulna to the elbow. Why? It wants to prevent that radius from dislocating proximally. So once it's not there, once it is weak, a fall would push the radius over the ulnar bone, and then it's going to cause a damage. So the answer is the interosseous membrane. That is the structure that is responsible for longitudinal instability and proximal migration. That's disruption of it is going to cause all this. So yeah, that's the answer for this question. Right, so see you on day 16. Thank you.